Welcome to this unusual press conference for the Emergency Management EOC here in Blackhawk County. This is an unscheduled press conference outside of our norm, so this will not follow our normal briefing schedule. Dr. Nafisa Sisi-Abonye will not be here with us today, so we will not be briefing or speaking to the numbers or the medical information this afternoon. In order to allow for our local elected officials to address their concerns with some of the information and that landscape shift that we talked about yesterday, to address some of that here in our community. I've given you the lineup, and we'll handle that kind of the same way. I'll introduce each speaker and let them come up and give their remarks, and then we'll hold questions till the end. Our first speaker is the chairman of the Blackhawk County Board of Supervisors, Supervisor Chris Schwartz.
Thank you, Sheriff Thompson. I have a letter that I'm going to read to you that is on behalf of 19 different elected officials here in Blackhawk County. This is addressed to the Tyson's Food Incorporated. We, the undersigned elected officials of Blackhawk County, Iowa, call upon Tyson's Food Incorporated to take all steps necessary for immediate mitigation of the risks to our community and your employees from an outbreak of COVID-19 at your Waterloo operation. We understand these are extraordinary times, but steps must be taken to ensure the safety and well-being of Tyson's valuable employees and our community. There is now an outbreak of positive cases of COVID-19 at the Tyson's Waterloo operation. We ask that you voluntarily cease operations on a temporary basis at your Waterloo facility so that appropriate cleaning and mitigation strategies can take place and be in place for the resumption of production. We ask that you take this step to allow for test results to catch up and data to be collected so that community healthcare practitioners can get a handle on the situation. The state of Iowa is now sending thousands of test kits needed in relations to Tyson's Food Incorporation here in Waterloo. We ask that you fully participate with the state in this critical testing operation. Tests are of limited supply, and it is important that this be done right. This outbreak at a facility of your size puts great risk to the safety and well-being of all residents in our community, especially the elderly and vulnerable. We ask that when you do reopen, to practice all available social distancing, screening, and deep cleaning practices available. This will mitigate the risk that our local healthcare system is not overwhelmed while simultaneously working towards ensuring sustainable production in the future. We do not make this ask lightly. We understand the importance of this facility in our national food chain and the cascading effect that our requested closure would have on the supply network. However, we must all come together at this time to do what is best for the long-term safety and health of your community. I will now read the names of the elected officials that have signed on to this. First, myself, Blackhawk County Supervisor, Waterloo Mayor Quentin Hart, Cedar Falls Mayor Rob Green, Blackhawk County Supervisor Tom Little, Blackhawk County Supervisor Linda Leyland, Blackhawk County Sheriff Tony Thompson, LaPorte City Mayor Dave Neal, Gilbertville Mayor Mark Tomey, Hudson Mayor George Wessel, Raymond Mayor Gary Vick, Evansdale Mayor Troy Beatty, Duncanton Mayor Mike Shares, Waterloo City Councilperson Jonathan Greider, State Senator Bill Dotzler, State Representative Bob Kressig, State Representative Timmy Brown Powers, State Representative Ross Smith, State Representative Dave Williams, and State Senator Eric Giddens. Now, it is no easy task to get that many elected officials to sign on to something in such short order. It really just shows the magnitude and the severity of the situation that we're in. And we really just implore Tyson's to be a good actor and to become a good partner in this, because right now it's not been the case. And this is not just to pick on one company in our community, but that's where the most serious crisis is right now. We continue to be in contact with all other large operations, especially large manufacturing operations, and encourage them to take steps immediately to avoid getting to the point that Tyson's has today. This is just of critical importance for the health of both the employees at Tyson's, but also the health of everybody in this community. Thank you.
Our next presenter will be Representative Ross Smith from the Iowa Legislature, House District 62.
Thank you, Sheriff Thompson. Thank you all for being here this afternoon. So we have been past the time of making decisions based on the dollar or convenience for a long time. The weight of responsibility weighs heavy on industry and us all as individuals. There's no denying that a collective, robust, and more proactive response is the only way that we guide our communities through this crisis as quickly and safely as possible. Sadly, contrary to the governor's statements this morning, we're not ahead of the outbreak at our local Tyson's processing plant. I've been a manager at a warehouse before, and I know if leadership really wants to know about employee safety, you speak with the employees. I've done this, and some of the things that I've read and some of the stories that I've heard break my heart, even if they're only half true. The opportunity to do the right thing was presented, and that action was not taken. The lack of strong, consistent guidance and direction from state leadership has increased the threat level to our community from COVID-19. Not only placing countless lives at stake, but potentially sacrificing the long-term viability of our food markets nationally and our pork producers locally. You know, as a guy that lives a mile down the road, as a father of two, as elected representative for this district, knowing the demographics of Black Hawk County and the disproportionate fatality rates amongst minorities and poor individuals, I'm scared as hell for what this outbreak looks like from our community and people across the state. You know, I call upon the governor, in addition to the 2,700 test kits that she's provided to our community, to provide additional PPEs to our healthcare workers. With us, we want her support in calling for the voluntary cease of operations at our Tyson facility to allow for deep cleaning and testing of all employees in an effort to safely and as soon as possibly return to normal operations. After conversations and consulting with reps from the Iowa pork producers, with the closing of plants in other parts of the state, they believe that we have roughly 7 days before market-ready hogs will be forced to be euthanized. We're not sure if it's possible with this timeline for the turnaround and cleaning the facility, but we do know that as Iowans, we'll stop at nothing to try. The longer that we wait to adequately address this crisis and this issue, the longer and worse the disruption will be. I implore the governor to help us with all hands on deck to protect the future of Iowa pork producers, help us with accountability for bad actors during this time of crisis, and ensure the health and safety of workers and community members here and across this great state. The time for wait and see is done. We need a truly unified front, regardless of the things that divide us, whether it be political affiliation, language, or location. This is our fight. Together we will get through this, stronger and more unified. Thank you.
Our next presenter is Senator Bill Dotzler, Senate District 31 of the Iowa Senate.
Thank you, Sheriff Thompson. I really appreciate the opportunity to be here, and I thank the members of the media for practicing social distancing, which people can't see at this time, at this meeting. And I also want to let people here and are watching at home or on Facebook or wherever this process is being viewed, that this is a very serious issue. Your Cedar Valley delegation, Representatives Bob Kresick, Dave Williams, Timmy Brown Powers, who aren't here today, We're very involved in the conferences and the meetings in this community and are up to speed and are working very diligently. Also, my partner in the Iowa Senate, Senator Eric Giddens, is here, and he's also been very active. And because Representative Smith and myself actually represent the district, we were chosen to speak on behalf of the legislators in our community. And me being here does not mean that I'm the person that's doing the most work out in the community. And so I just want to make that very clear. I've been involved in Iowa workforce development my 23 years in the Iowa legislature. I spent 10 years as chair and funding chair for Iowa workforce development and the OSHA department. And I listened very closely today to the governor's conference with scrutiny. And unfortunately, I felt that the governor was not really leading the state of Iowa in the right direction and was misinforming Iowans, maybe not intentionally, but it clearly seemed that way when she talked about the care that's being taken at Tyson, Iowa Workforce Development, and the OSHA division. In fact, that they were on top of this. And then comments yesterday about the USDA, the Department of Agriculture, being there looking out for workers. There's no truth to that. First of all, the USDA is concerned about how the food is handled. It's not their role to look at exactly how workers are being treated or their health and safety in the workplace. Today she talked about OSHA. Well, yesterday I spoke to the deputy director of Iowa Workforce Development and requested that OSHA come in and look at the plant. Well, today she said they're on top of it, but it is my understanding that there hasn't been one single visit to any meat packing facility in the state of Iowa by OSHA since this coronavirus has occurred across our state. That is deeply troubling. And when I hear about that the management at Tyson is really concerned about the welfare and work and the workers and their health in our community, the evidence is not there. Also, when they say that workers are being treated very fairly and there really isn't that many problems, the evidence isn't there. And it's been clear to us that this case, the virus outbreak at Tyson and the conditions that have been there for spreading the virus have continued for some time prior to what's occurred over the weekend. I've had some interviews. There have been some interviews put together by members of concerned organizations in our community from people who work there. And their testimony has said several things. First of all, they haven't felt safe at work. They are very concerned about the working conditions. They work through breaks and don't get breaks. The management does not keep them up on what's going on. And I have some exact quotes from individuals. I'd like to read just a few of them to verify the things that I've been saying. Here comes, and these are anonymous, and these are all Tyson plant workers. I've been in the U.S. now for 5 years. I'm from Congo, and I don't speak English. I have diabetes, and it's really worrying me. They are trying to prevent us from getting sick by putting glass between workers in the cafeteria, but still that's not good enough. Working conditions are very risky on the floor because once we're on the floor, there's no distance between workers and everyone is right next to each other. I do not feel safe at all. They may have put safety measures in the cafeteria, but what about the locker rooms? Locker rooms are very crowded and tiny. People have been giving the employer hints by skipping some days of work and only showing up 2-3 days a week, but that's not still enough to be safe. Because we can't work without being exposed to others, the best solution right now is for Tyson to close down so we can stay home and be safe, especially workers like me with diabetes or who are elderly. One of the questions that was asked of them is, do the workers feel unsafe because of employee protocols? And here's just some brief statements. I saw management put water in a hand sanitizer. They're bringing workers from sites that are shut down because of coronavirus to my work. I work 10-hour shifts and only get a 15-minute break and 30 minutes lunch break. I am tired and sick every day. I have to go to work because I don't want to be fired. A co-worker vomited on the floor at work in the line. Management let him continue to work and come back to work the next day. I'm scared because I will die because of work, but I need to work to buy food for my family. I can stay home sick to protect my family, but I don't want to be fired. Well, this is very troubling. When you think about the workers at Tyson, a lot of them don't speak English, have limited opportunities in our community, and they don't have a choice. They're concerned about their families. We've had individuals there that said that they had underlying conditions. They had to quit work because they were afraid that they were going to die, and that now, because they quit work, some of the state and federal programs will not give them unemployment benefits. It's something that we need to get fixed. And I believe that the governor ought to be honest with the people of the state of Iowa and let them know that just because Tyson says that they really care about their workers, I question why, if they cared about it, that they didn't do some of the common things that have been suggested by a multitude of media and doctors across the state for the last several weeks. And workers, until just recently, didn't have any kind of face masks. They're still in tight conditions. They're working hard hours, and some of them are saying that they're being forced to work through their breaks. Now, Iowa state law doesn't require that any employer have to give individual breaks, and they don't require, actually, our law is so weak that they are not actually required to even have a lunch hour. And when we've tried to change that in the past and hasn't been able to accomplish it in any way. So I know that Tyson is important to our community. I personally know people that are in management that work there. They're good people. And I wonder about the upper management in the leadership top down and why, if they were so concerned about their bottom line, that they haven't taken care of the workers that are really producing the product in that facility. And it's time this all changes. And I signed on to that letter because I really believe that the delay that's going to occur before they realize how bad it is going to continue to spread this virus through our community. We have heard on our conference call yesterday from healthcare providers in this community that a lot of their workers, their spouses work at Tyson. Now you have a direct contact to our nursing facilities across the Black Hawk County and the Cedar Valley that could spread into these facilities and affect our loved ones. And we know what happens with the most vulnerable people in this state. You're talking about increased deaths because we are not taking the steps necessary to protect the safety and health in our community. This is a very, very serious thing. And the only thing that sounds like to me that can be done is the citizens of the Cedar Valley and Black Hawk County stand together and make sure that we're wearing these masks. And I got to thank my sister, Joanne, for making masks for our whole family to make sure that we stay home. We need to stay home. You don't need to go to the stores or to places that are open to get plants for the springtime. Let's stay home the next couple weeks and make sure that we can control this virus any way we can. It's my deep fear that it's already been spread across this community, and there's really no safe place for people to go out in public without any type of protection. So with that, I'm getting myself a little worked up, but this is very, very serious, and the citizens of the Cedar Valley and the state of Iowa are going to be affected by it. It's not going to just be contained here. It will trickle out into the rural communities also. I'm very concerned about and lastly, I want to say this. The management at Tyson have been denying that we have workers from other plants that have been shut down in the state of Iowa. Well, we're hearing directly from individuals that work in the factory and health care professionals that said that those individuals from Columbus Junction are in this community. And it makes me wonder why they're here if they're not working at Tyson's. Why would they drive over 100 miles to get health care in Black Hawk County if they weren't in that community? So we've got a serious problem. I think it's time for the governor to step up to the plate, be honest with Iowans, and the management of Tyson's take this very seriously and follow the recommendations from all the leadership in Black Hawk County. Thank you very much.
Our final presenter today will be the Honorable Mayor of the City of Waterloo, Mayor Quentin Hart.
Thank you, state representatives and Supervisor Schwartz, for the powerful words and testimonies about the challenges that our workers are facing. And I would like to thank the Emergency Operations Center and all the parties involved for relentlessly advocating for the health and well-being of this community. And hearing some of the comments and being on the periphery of some of the changes that we've made over the last couple days, from the closing of dog parks to the closing of golf courses. Some people are very upset with me, and there are others that are happy because they're able to see that in the midst of the worst pandemic crisis in our lives, that I am using strong measures to protect the public. And I am choosing to prefer safety of the people over a few $1,000s worth of revenue. And we will continue to analyze the numbers of our cases locally and make decisions that are based on numbers. But please keep in mind that our region, Region 6, is at a level 10 according to the governor's matrix. And remember that none of the decisions that we make as elected officials are easy. No mayor wants to stand to have these types of conversations. But I believe that in the next couple weeks are a time to act, but not a time to panic. I believe that this is a time to stand up and not to be silent. And on Wednesday morning, Representative Timmy Brown Powers and I drafted an email directly to the governor's staff and the IDPH and asked for the immediate closures of Tyson's food plant. And because of the increasing rumors from workers and the incredible strain that this has brought on healthcare systems and our frontline emergency services. The email, in its essence, was not about food security, because right now I don't have any reasons about its safety, any questions about its safety. But it had to do with everything with regards to the safety of the men and women working in the plant and those they come in contact with. And these are our neighbors, our family members. These are our parents of the children that attend our schools, people that we know and love. And simultaneously, in addition to Representative Powers and my input, the Iowa Department and to the public health director and all of our elected officials, we're doing the same by reaching out to the IDPH, Governor Reynolds, and company representatives. And the governor contacted me on Wednesday afternoon and assured to me that the state was taking a proactive approach from increasing testing kits, quicker testing, potential mobile sites, and increased work with the CDC and Tyson's. And I'll be the first to say, yes, I appreciate those efforts. I understand the challenged position that she may be in. But even with this new information and this increased testing, we have to be the voice of the many employees that are afraid to speak publicly. We must still stand for our neighbors that work on the front lines in places like Tyson or other essential businesses and services. It is our responsibility to speak up, and the letter that Supervisor Schwartz read is a direct message stating that we want the safest environment possible at Tyson's. And the letter was a show of solidarity from local leaders in this county on our belief that the quickest way to slow this outbreak and its spread throughout the county is through temporary closure. We must know how many cases that we have at this plant and its potential trajectory now before the spread is even greater. And this is about the lives of our people and about a virus that doesn't discriminate who it impacts. What we do now will forever echo in eternity. But we are our brothers and sisters' keepers. And this is one time in history where we cannot fight with each other, point fingers or pass the buck. If we engage in this behavior, we will all lose. But if we fight together against the true enemy, the virus itself, and unsafe business practices, then we have a better chance to come out on top. But make no mistake, our corporate partners, as was mentioned, are critically important to Iowa and help make our nation, our state, proud leaders in agribusiness and feeding the world. But they must also partner with us to be the example of how to show care for the least of those in our community. So yeah, we need your prayers, we need your support, and we need you to realize that we are in this together. Our goals are not to disrupt industry or choose fights against partisan lines, but to make sure that we save every possible life. So now, to the many frontline workers that are feeling overworked, unappreciated, and scared yet courageous, we all want to thank you. And also to the young people that are at home, bored and tired of listening to mom and dad. And the parents and guardians and senior citizens that are fed up and worried about what tomorrow brings. Listen to me. Be very encouraged. An army of professionals, frontline workers, caregivers, and behind-the-scene volunteers are fighting for you and fighting to be your voice. And we can and we will make it through this. And lastly, Dr. King stated, the ultimate measure of a man or woman is not where they stand in times of comfort and convenience, but where they stand in times of trials and tribulations. So let's continue to stand together, Black Hawk County. Let's continue to stand together, Iowa. Let's fight the good fight. Hold those accountable that are not practicing safe practices for our neighbors. And I'm asking you to stay safe at home and follow the recommendations and guidelines that have been laid out before you. Thank you.
These conclude our prepared remarks for today, pending your questions. Amy.
How long will you give Tyson to respond to your request?
This letter was sent to Tyson's at 4:30 yesterday afternoon. Did receive acknowledgement this morning that they did receive it and are reviewing it. We're going to keep the pressure on because either Tyson's needs to voluntarily shut this down, or the governor needs to take action, because this is a critical need for our community. We're here talking about the lives of working class families. What are the jobs that working class people do in this community? It's working class people that are stocking the shelves in the grocery stores. It's working class people that are CNAs, that are nurses, that are those frontline healthcare providers. If Tyson's and the governor do not get ahead of this right now, we're heading into a big crisis in this community. And so we're calling for immediate action, and we're not going to let up either with Tyson's or the governor on this.
If the state did announce today that it wouldn't currently order a closure of the Tyson's plant, is there a step that the county would or could take, or officials could take, independent of the state?
So it sounds like the legal opinion is that only the shutdown has to happen pretty much from the state. That the county Board of Health could do something, but the state can override it, so that the code is written so that they move in tandem together. So we need the state to take this action. And where it has happened, where the closures have happened in the states so far, have all been voluntarily done. And that's why we're pleading with Tyson's, because the governor has, quite frankly, not been willing to take this action yet.
Did Tyson say anything as to which way they're leaning on this?
No, just an acknowledgement that they received the letter.
Had there been any prior communication to the letter from any of the officials, like reaching out to Tyson to kind of express concerns?
Yeah, I think there's been the multiple communications from different levels to both from different officials here to multiple levels at Tyson's.
Sure. Sorry, I should have excluded Thompson from that, because that was obvious. In regards to some of the comments that Senator Dotzler read, just kind of curious, how did we vet the legitimacy of some of those folks? Did you kind of speak with them one-on-one? Did your staff kind of confirm their employment?
Well, they came from an organization called Embark, who works with refugees in our community, who sent out interviews to individuals that they have been working with directly in the facility. And I believe these to be true. I've spoke directly with Embark individuals. They were people that wanted to remain anonymous because they were deeply afraid of their jobs. There's much more that I could have took up a good number of time on in the community that is occurring there at Tyson. Just recently, one thing that I didn't bring up was an individual who had a temperature that was afraid to go to work or not to go to work because they can't afford not to. They're living on the margins. So they went. He knew he had a temperature. The person that was taking the temperature at the gate said he was fine, and he went into the plant and got feeling a lot worse and went home sick and has been tested, and we don't know the result. That makes me wonder about the security that's being there. Now, either the individual doesn't know how to use a thermometer, or two, they were too big of a hurry, or three, they're being instructed if people are marginal, let them go in the plant. That's very troubling. That's why we are so concerned, and we're hearing there's a whole litany of conversations from people through this organization, but also Hawkeye Community College's instructors who've been working prior to the virus hitting and the shutdown at Hawkeye, where these individuals are taking adult basic education classes to upgrade their skills, have reported about their fears. And just last week, before this broke, I had a whole list, and it was mailed to other legislators. One said that they were bringing in people from Columbus Junction to work in the factory without testing them. Two, they're making them work through breaks because they're behind on their workload and not being able to work. They're working in without any face masks in very tight conditions, and they are deeply afraid because they know people are coming to work sick, and the management was okay with it because they needed to get the work out the door. That is extremely troubling. And we do know how important the meatpacking industry is to the economy of Iowa. We need these plants, but it is unconscionable, and I do not understand why the management, the upper management of Tyson's organization across the state of Iowa, is so concerned about their product and making sure that it went out the door. Why wouldn't they protect the workers that produce that product to get it out the door?
Have you expressed some of your concerns, like reach out to anyone from the governor's office, and if so, how have they responded?
Well, I spoke directly yesterday when this thing really started to break with the Deputy Director Ryan, explained to him everything that I had just relayed here, the things that I've heard directly from Hawkeye and from their employers, plus the Embark organization that works with refugees in our community. And quite frankly, he was very surprised. That's when I told him that we needed, OSHA to go in the plant. Now today, we heard from the governor specifically say that they're waiting for federal guidance. What kind of federal guidance do we need? I mean, what new thing could be said to protect workers? You have to be living under a rock to not understand how this virus is transmitted and what a dangerous situation those workers are in. It's shocking to me.
Did the deputy director indicate that, you said he was surprised, did he indicate that he might be on board?
I told him, I asked him to pass those conversations on to the governor and the director, Thompson, directly, and he said that he would make people aware of it.
Are you providing a copy of this statement anywhere? Is it on the website, or are you providing it to media?
I have copies here.
And I don't have a written statement, and the copies that I have do have some names on it, so I can't give those out.
Do you think that these developments are indicative of a larger issue? Because we have 2 Tyson plants in Iowa now, both with outbreaks. There's one in Tennessee. There's one in Washington State. Do you think it's a issue with the company specifically, or more so the industry?
It's industry-wide, but also it's very indicative of the company. As a person that sat on the labor committee and funded OSHA in the state of Iowa, and back when it goes clear back to when we had Governor Vilsack and Governor Culver there trying to really deal with some of these issues, and had OSHA take a look at what was going on in the facilities. And I know the management always says they really care about their workers, but do they care about them because they're producing a product, or do they care about them and their families because they're human beings? And we've seen speed up on the lines, carpal tunnel injuries, cumulative stress injuries, the high amount of work that they do, the limited number of breaks. I actually had individuals who started wearing Depends because they could not get a restroom break and had to wet their own pants in order to stay working on the line, and needed to keep it from running down their legs. It got that bad some years ago. Now, today's conditions I'm not sure about, because I've been excluded from that in the last few years. But I really am concerned about when they say they care about their workers, their actions must meet that for me to believe it, and that's not occurring.
I think also, if I could add one thing, to the senator's comments, we have to understand the demographics of the individuals that are typically employed in these places, right? When we look at COVID nationally, we understand it has a disproportionate impact on minorities, and also those living in underserved communities, those on the lower side of the socioeconomic scale. And when you have that coupled with an outbreak, when individuals don't have resources to get help, or don't have a primary care physician, that's when this thing compounds and exponentially impacts our community. And not just today, right? I think the coronavirus is an acute development and maybe in the facilities, but the working conditions may not be. And the way that these people are served, whether it be in the healthcare system or our educational system, we have to do better. The underlying condition is being poor. An underlying condition with COVID-19 is being a person of color, puts you at a higher risk of dying from this. And we have a large immigrant population in our Tyson facility, and we have to be mindful of that. A couple of things that we have to be really aware of is that being an essential employee does not mean that you're an expendable employee. And somewhere along the lines, those two things have been convoluted to become the same, and that is not. So that's why you see us up here with such emotion and such anger, because our hope was that in a time of crisis, when we're all made equal, that we would inherently do the ethical, the morally right thing. That wasn't done. People were taken advantage of. we talked about validating some of the stories. Okay, I talked to an employee from Tyson's over the phone who's related to me, who called me crying and angry because they didn't tell her that somebody tested positive and she has asthma, severe asthma, and was on her way to get tested, trying to get directions to where she should go, and she was fearful of her life and what that means for her son. These are things that we have to be mindful of. These are things that we're asking our employers to be mindful of and be vigilant about. Your dollar, you can earn that dollar tomorrow, but if your workforce isn't taken care of, they won't show up tomorrow. I'm really fearful that if we don't address this issue, if Tyson management doesn't address this issue effectively, their workforce will either voluntarily stop coming to work or be too sick to work. That puts our state, our nation, our global economy, our global food market in a crisis situation. We don't need to compound crisis upon crisis upon crisis. We need strong direction, strong guidance, and real leadership from our governor in which direction we're going to take our state right now.
Do we have any idea how much is actually produced at this plant?
I believe based on my visit last Friday, they process approximately 20 head of hog a day.
Do you know how many workers there are currently?
2,700 workers are employed at the Waterloo plant.
At the state's threshold for an outbreak, that means that 270 workers would need to test positive, but the county has issued it as an outbreak. What is the county's threshold for an outbreak?
Again, I think Dr. Nafisa addressed that yesterday. There was a combination of several things that converged simultaneously based on her conversations with IDPH that kind of encouraged that declaration. Partially being the number of people testing, the number of people symptomatic, the number of absences being related to the health department. Our visit to them last Friday.
It's not a hard number, is what you're saying?
Correct.
I wanted to ask about Safe at Home. Mayor Hart talked about this a little bit, and some of the other mayors had too, that if the county got to a spot where they felt like they could issue it, they may or may not be able to get everybody on board and issue something like that. Has that been talked about since we've moved up to a 10 in Region 6?
So provide a little clarity on this. The legal authority to issue a shelter in place or safe at home order relies only with the governor. She had said something different a number of weeks ago, and we started looking at it and examining it. By the end of the week, we had reverse of decision from the governor's office and the legal opinion from the attorney general's office that in a public health crisis, that power only lies with the governor's office, unless they choose by proclamation to grant that authority locally, and that has not happened.
Tony, do you have, in the absence of Dr. Cesare-Boni, do you have a number of new cases and deaths today?
Again, because the purpose of today's briefing was not medical or healthcare related or health department related, you're going to have to wait till Monday when we do bring our medical staff back for that scheduled briefing.
Hypothetically, if Tyson doesn't take any action, if the governor doesn't take any action, do we have any options? What are our next steps, hypothetically?
Unfortunately, I think I touched on this a little bit earlier. The legal opinion that the Board of Health had received was that if they were to do it locally, it has to really be in tandem with the state, because the state can immediately override their decision. And so there's not a lot of good options if there's not voluntary action from Tyson's or action from the state. And that's what the legal opinion has been for the process during a public health pandemic.
Just wanted to clarify. Thank you.
Tony, I had a question about our PPE supply. Can you go over that briefly?
So both this morning at our 8 o'clock staff briefing and this afternoon at our 1 p.m., I did request PPE status updates from all of our medical and long-term care facilities. They indicated, and I asked it for a forecast of at least 48 hours through our weekend, and they indicated to me that they are currently green. meaning that they are good to go for at least another 48 to 72 hours. We are currently sitting on a small, short supply of masks, and we are currently sourcing other locations outside of our traditional Iowa Homeland Security resources to try and get some PPE. But again, through our traditional Iowa Homeland Security and state stockpile sources, that's pretty well dried up, I think. So the timing is horrible that we're seeing these spikes and the surge such, and unfortunately with the Tyson outbreak at the same time, that we're starting to see a drawdown in the amount of PPE we're able to get.
Where is the bulk of the PPE now coming from?
Right now, today, it was mainly volunteers. Homemade masks. We even had homemade shields come in today. A young man made, I think he made 30 shields. So it's piece and peck type stuff at this point.
Are you looking for more of that if people are watching at home?
Absolutely. As long as it's well constructed and it follows CDC guidelines, those are things that we're very entertaining of. I know there's a lot of clinics and a lot of long-term care facilities that are still looking for great ideas. One of the things that I do know that we're getting rather red on, which means that we're in short supply or dangerously low, if not out, is gowns. And there's just not a good remedy other than, looking at other creative ideas. People are wearing raincoats, they're wearing lab coats and things of that nature that can be laundered because we just have no gown supply to be able to provide. Any further questions? All right, folks, that concludes our briefing for today. Please stay safe this weekend, and we will have you back here tomorrow, or Monday rather, at 3:30. Thank you so much for your time.